So I think we had some really fascinating insights there, and we're fortunate to be joined by Ms. Sharina Balaratnam once more. We've got a couple of questions that have come in live from the audience. So Sharina, the first, due to the current climate and coronavirus concerns, are there any other tips and tricks that people can be doing during this time?
That's a great question, Francesca, and one that we're going through right now in my clinical practice. I think first and foremost, we need to make sure that patient safety always comes first. And I'm taking this opportunity to educate patients that they're in the safest hands with my team, with the treatment, as well as with everything that we have to offer. So I'm also taking the opportunity to train our patients as well. Train them by webinars, virtual reality, podcasts that we'll be doing on a very regular basis at the clinic, so that they're still kept in the loop of the benefits to the treatment, their at-home protocols, which most of them are on that as well as what to look forward to in the future when all this comes back to light. I'm also going to make a huge approach, which we are doing right now, to train not just myself but my team. What a great opportunity to have the time to be able to go back. We spoke about that earlier, didn't we?
I agree. I think really important to look at the positivity that can come out of dark times and channel that into further education and research.
Thank you.
We've got another question. How can clinic owners engage patients during these times?
Gosh, we are so lucky to actually be in the light of the internet. 30, 40, 50 years ago, as a business owner, I don't know what one would do, because you'd have to walk the street, you'd have to give out your call card, you'd have to give out your brochures. That was the main form of communication in order to promote, advertise oneself. And then there was the telephone and so forth. But now we have the internet, and guess what? We have smartphones. So everything that we can do is literally at the touch of a button, right?
Agreed.
Again, we spoke about that. So I use social media in various contextual forms, whether it's with my Instagram page, my Twitter page, my LinkedIn page, to connect with so many different audiences.
And you do it very well. You're always in constant communication, which is important, I think.
Thank you.
Next one, about how to virus-proof your system. How are you assuring patients about the disinfection of the system that you're using in clinic?
I think that's very relevant outside of this climate that we're currently in, but also it's something that we should be doing routinely on a day-to-day basis.
I agree.
And aside from a day-to-day basis, we should be doing that between patients anyway. So in my eyes, nothing's changed. We're going to be doing exactly what we do. We're just maybe taking it up a notch, Francesca. So we tell our patients that. I ask my team, please articulate that to your patients, and maybe just showing them. We probably didn't show them before. We're doing it.
Absolutely.
Maybe just making them really realize that, hey, we did this before. We're just now showing you what we've done all the time.
Yeah.
But I, for one, feel that we have really gone just an extra mile. Gone from the days of my NHS where we used to do this all the time. I think this is a great opportunity to just recap, reset, and do these things moving forwards in a much more dynamic fashion. What do you think?
I agree. I think, it's always important to sort of have a very good grasp of health and safety, for not just for your patients but for your staff as well.
Yes.
And I think the current climate, if we can see a silver lining, it's maybe it's refreshing our understanding of how things work and how to operate and put best practice forward.
Always.
So Sharina, you have a lot of experience in treating clients, and I think when we're looking at the concept of using HydraFacial in combination with medication and laser for acne, what combinations have you found the most effective?
Do you mean in combining the HydraFacial treatment with all of the other treatments we have in the clinic?
Exactly. How are you combining the HydraFacial into your current clinical offering?
Oh, that's easy. We virtually make it compulsory, and I'll tell you why, Francesca. It does more than just make people look good. We know it does that. We've all had the treatment ourselves. Have you had one?
Yeah, I swear by the HydraFacial. My skin loves it.
Your skin loves it. Mine does too. But we also know that the steps has a very key physiological benefit. So we see results. Not just today, it's going to continue to progress as well. And that's really important for management of acne and things like that. We're managing physiological changes to our skin, not just for the acute, but for a long-term basis, because this is a problem that's taken a long time to manifest. So to articulate that to patients for the long term is really, really important.
I agree.
And then the next thing to think about is patients with acne tend to have other things going on with their skin. Chronic inflammation manifesting itself in facial redness. That's where IPL, photofacials, and lasers come into play. They may even manifest themselves in having textural changes, meaning acne scarring.
Yeah.
And guess what? Whilst the HydraFacial prepares their skin and gets it optimized, we can then present it to our laser technology. So I feel if I had to look at my HydraFacial and my other technologies, it's literally weaved in to every single step of their journey. And it makes not just the result better, I have to say it makes the experience so much better.
And I love how you sort of talk about combining it so fluidly, because I think so much of what we speak about today in the industry is about a holistic approach to aesthetics and well-being. And I know from personal experience you do that very well at your clinic at S-Thetics. A quick question about Hydratite that's come in. Do patients see an improvement of the results of radiofrequency when it's combined with the HydraFacial? I think there are studies that show it's had a great effect, am I right?
Oh, very much so. If you really think about what the target for radiofrequency is, the RF energy loves water. It's a no-brainer. That's what HydraFacial does. It's going to remove all the old toxins from the skin that doesn't need to be there, but it's something that we make every day. So that's step one, the lymphatic drainage.
Yes.
And then through the steps, we're removing all the dead skin. So guess what? The radiofrequency energy has more greater opportunity to get to its target. And then one of the steps is pushing lots of hydration, hyaluronic acid into the skin. So guess what? That's your target right there. So as I said, the synergizing of both of them together is absolutely perfect.
It fits together wonderfully, and I think what HydraFacial does so well is it delivers that instant result to the skin, and the Hydratite delivers the instant tightening, which
that's right.
You know, I think we all love immediate gratification.
We do.
Next question: how I recovered my return on investment. What is the average length of time? Somebody is asking here. My capital can be recovered.
Okay.
Is that one that you had any thoughts on?
Gosh, you know what? That's a great question. So really what you're trying to say is, when can I see my return on investment?
Absolutely.
I'm going to divide, thank you. I'm going to divide that question into maybe two answers if possible. So the return on investment, number one, is going to be satisfaction and result from the patient. So for me, that return on investment is so satisfying because you're seeing someone walking back in saying, thank you, I look fantastic. Exactly. And guess what? I love that feedback every day. So, you know, that is priceless, okay? And the next, and they will continue to stay with you for a very long time. So you have a long-term relationship, a long-term trust, and guess what? When you have that, you're just going to see better and better quality results every day.
Of course.
Next, we talk about an investment portfolio. So then we took a slightly more commercial angle. I find that you do need to give these treatments time. When you're firstly bringing something into a clinic that no one knows about, and Francesca, I think you know I started the clinic from zero, so you're starting it from nothing. Patients need to get confidence. But we paid that first device off very, very quickly because of the branding from the HydraFacial themselves. People all over the world had heard about it. So when they contacted the clinic as soon as we had it, we already had a flood of patients coming in. So that was easy. And as soon as patients just tried that one treatment, they were sold.
I think what's interesting also about the HydraFacial from my perspective as a consumer is it's a very good entry point into a lot of these slightly more significant aesthetic procedures. And I've heard, you know, other doctors and practitioners talk about how it really does open the door to subsequent treatment that perhaps you would have been hesitant to explore previously.
And it's a great point actually, Francesca. You are absolutely right. In this aesthetic space, it's a minefield, number one. And it can be a scary place. People could be nervous coming in. They may not know what we're about. They may not know what a clinic is.
It's a whole new environment for them, isn't it?
It is. And I found that this was, you're absolutely right, like a gateway into the practice. They were coming in for one thing, which is the HydraFacial, and you know they're going to get a great treatment result and experience. But through the doors, they can then have the opportunity to have the viscous skin analysis. I think you've had one before.
Yeah.
And that gives a whole new opportunity to really explore all the other avenues and all of the other possibilities that one has to offer in the clinic.
Yeah.
So we have seen from someone even coming in for a facial injectable, I would say about 75% of all of our patients coming in for injectables have become HydraFacial patients.
God, how
What do you
brilliant
think?
is that? Also, you know, they have a very keen awareness now of their underlying skin health,
Yes.
which I know you feel very passionately about. So I think we've got another question perhaps from a surgeon, which is very relevant to you, Sharina, being a former surgeon yourself. What is your perspective on combining HydraFacial, fractional laser, microneedling, and also using HydraFacial as a very good way of prepping the skin before a surgical procedure?
I think that's a fantastic question. So take, for example, I'll give you one analogy. Take, for example, the surgical facelift. So during a surgical facelift, you're going to lift the skin and you're going to reposition it to get a better quality position of the face for structure and contour. If the skin quality does not look great on the outside, we're missing a point. Second most and very most importantly as well, if the skin isn't functioning well because of damage over time, sun damage, loss of elasticity, poor circulation, poor microcirculation because of cigarette smoking and everything that life has to put in place, then guess what? The quality of the circulation isn't going to make the tissue heal. So my analogy for the skin of the face and then finally for the scalp solutions as well is what we do to prepare the skin, which we do well with HydraFacial, is what we do during those surgical procedures, which happens again woven throughout as well, but we have to be respectful of sutures and stitches and all of that.
Of course.
And then finally there's the aftermath. What about the maintenance? You can actually take all of that and take it up next level. So I always get my team when I'm conversing with them, trying to get them to understand where it all sits. It actually sits across the board. It sits in the present, where the patient is right now. It sits in the past because we need to clean up and prepare. And then when you trigger the tissue with microneedling, radiofrequency, surgery, whatever the procedure you're thinking of, you're really going to take that result to the next direction. I'll give you an example of what I say with lasers. I use the HydraFacial to clean the glass so the light can go in.
That's a great analogy. You have a very good way with words. A quick question about building customer loyalty.
Yes.
What's the number one thing you've done to build customer loyalty at S-Thetics?
The one thing we've done is we have taken time. We've taken time at the consultation. That is the most important part of the entire journey.
And how long is a consultation?
Well, we take 45 minutes here in the clinic, Francesca. We build that around a really detailed skin analysis. So that actually forms the benchmark and the ground level, okay? Through that, we can educate patients and find out more about their past, their present, and then also plan their future. So we use that as a tool to wrap around everything that we do. And with the HydraFacial, guess what? You can actually see results. So we measure results now with the Visia. And through that, you have follow-up as well. So the most important thing that I've done is we do a great consultation process. Myself, my team, my colleagues, and that way patients really get to understand and connect. Once they connect, then that way it builds retention, reputation, loyalty. And now that we are, so blessed to be 5 years into the practice, I'm excited. We've just brought our third device in January.
Congratulations.
Thank you. Thank you very much. And in answer to your question, we have patients still coming into the clinic who are continuing to buy their third and fourth and fifth program of treatments. And that says a lot about the long-term relations that one can develop with having a treatment like this, because you're not just getting a result, they love the way it makes them feel.
Absolutely, and I think you're right to say that it's important to invest time in patients, but I think what you're also doing by virtue of that time and by the Visia is building up their own knowledge, and we all know knowledge is power, and I think that's really key to connecting with your patient, as you've said.
Thank you.
A couple of more questions. A lot of treatments don't allow lasers, particularly in dark skin. What about HydraFacial? What are your thoughts on this?
It's perfect. The beauty about HydraFacial is it can treat all skin types, and here in the clinic we do treat all skin types. We're also in an era now where Fitzpatrick classification, which categorizes patients into a 1 to 6, for example, Francesca, we're seeing a lot of blending and intermarrying, so we're not going to know who we're treating at some point.
Absolutely.
Melanin counts are going to change, so this is a one-size-fits-all. It fits for everybody. We have patients here, Francesca, from the age of 18 right up to 87 now.
That's brilliant,
and it's extremely humbling that they can all really benefit from the treatment at any stage of their aging profile. So from a return on investment, you asked me that a couple of minutes ago, I actually feel it's a great return on investment because when we think of purchasing devices here, sure, you're looking for the best, you're looking for the best brand, you're looking for the best team, which is the people to work with, you're also then looking at the best product as well.
Agreed.
Is the product going to remain stationary? No, it's not, because we've seen introductions of new technologies with HydraFacial, introductions of new serums. They've got a brand new growth factor serum that's just out right now.
Yes.
I don't have it right yet, but I'm certainly going to get it because I want to take the results next level. We've also got the brand new HydraFacial Keravive, which for me is a beautiful extension because skin is everywhere.
Absolutely.
So we're
I think we've got another question on the Keravive actually.
Okay.
How does it work with the PRP element? And I suppose maybe from your perspective as one of the first clinics to start using the device, how does it protect against hair loss?
Okay, great question, Francesca. So it was a no-brainer for me to bring HydraFacial Keravive into the clinic. My patients are so convinced with their results. We see it every day. Patient satisfaction is high. Secondly, from a return on investment, again, very high from the HydraFacial. When I look across the board at all of our patients for the last 5 years, a large majority of our female patients in particular, which is whom we see more of, are suffering from one thing: stress.
Agreed.
I don't know if you find that in your
I
travels.
think it's a huge factor in everyone's lives, and
Yes.
I'm sure you're about to say that the links to probably hair loss and even hair thinning are quite significant.
Incredibly significant. So guess what? I carried out an audit in January and I asked all our female patients to rate their stress levels. Whether it's good or bad stress, 7 to 8 out of 10. And if you're running at that all the time, you are going to experience thinning, brittling, changing of hair color, all of that. Majority of our female patients said, yes, I'm answering to yes to that.
Yeah, of course.
So that is what we're really trying to connect patients with. There is a choice. There is another treatment out there that they may not be aware of. There are actually patients having PRP for their face, their scalp, everything else. And now we're saying, hey, guess what? We've got something to actually help the PRP result get better. Help your follicular unit extraction result get better. Help your transplantation result get better. There are so many things about patients I feel we still don't know yet. Sure, we might give them a questionnaire to fill up, but they might share a lot more by just introducing them to the potential.
It sounds amazing, almost like it can supercharge all of the different modalities and machines that you're possibly already using.
It will, and at the end of the day, who wants to lose their hair?
Agreed, I'm with you there. Well, I think that's probably all we've got time for in terms of questions. Sharina, thank you so much for your expert insights as ever, and yeah, for joining us today.
Thank you so much, Francesca, for the opportunity.
Nice.